I'm Dr. B. I'm a board-certified physician, and I like to make medical education videos. Today's video is on histrionic personality, or HPD. We'll look at what is it, what does it look like, and stay until the end to learn if there's any treatment. HPD is defined as a pervasive pattern of excessive emotionality and attention-seeking, beginning by early adulthood and presenting in a variety of contexts: work, home life, romantic relationships, and peer relationships. Because it is a personality disorder, it isn't something that comes out of the blue and begins as an adult. In retrospect, it can almost always be identified from an early age. Pervasive means it's present all the time in every and all kinds of social situations. Histrionic personality, or HPD, is one of the cluster B personality disorders, and this includes the personality disorder group demonstrating behavior that comes across as dramatic, erratic, or extremely emotional. And there are 4 cluster B disorders: antisocial, borderline, histrionic, and narcissistic personality disorder. Although there can be significant overlap between the cluster B personalities, today we're going to concentrate on HPD. In the DSM-5, HPD requires 5 of the following 8 criteria. Number 1, someone with HPD is uncomfortable in situations in which he or she is not the center of attention. This isn't just a tendency, but is a strong drive that is subconscious to do, say, and act in a way that makes others pay attention, to make others look at them, notice them, and interact with a person with HPD. This can be in the professional setting with a doctor or an attorney, or at the grocery store. It can be socially with friends, family, peers, and romantic partners. And it can be occupationally at the work and in the job. Those with HPD will often create a scene wherever they are, whether they're at work or out socially. Any action that says, "Look at me, look at me." Number 2, someone with HPD has inappropriate, sexually seductive, or provocative behavior with others. This doesn't mean in the bar or at a party being flirtatious and trying to meet a romantic or otherwise partner. This seductive and sexually inappropriate behavior is in all and many situations, especially where it's completely inappropriate, like in a professional setting, at a doctor's office, on a first visit with a physician, at a friend's home with a friend's spouse, or even at a movie theater waiting in line. Someone with histrionic personality disorder might suggest a sexual encounter with their physician, their attorney, or their auto mechanic. This consistently alienates them from their peers and especially creates strained relationships because they don't recognize and respect appropriate boundaries of others' intimate relationships. Number 3, someone with HPD displays rapidly shifting and shallow expression of emotions. They can rapidly move from depression with tears and anguish to elation and happiness in a very short time, and neither emotion really has any depth or true meaning. Number 4, someone with HPD consistently uses physical appearance to draw attention to themselves. Now, there's often an overlap with this criteria of needing to be the center of attention and being inappropriately sexual. Excessive time, energy, and money is spent on personal care, grooming, and it's often seen in clothing. Someone with HPD may wear bright, colorful, and inappropriate clothing, like a bright yellow pantsuit at a funeral. They also commonly wear excessive jewelry, very expensive, worn obviously, and then wandering and fishing for compliments to make sure that others see their very, very obvious jewelry. Someone with HPD can also use physical appearance that is a lack of clothing, dressing scantily in a manner that draws attention and is out of proportion to the current social setting. Wearing a bikini top to a business bar is an example. Number 5, someone with HPD has a style of speech that is excessively impressionistic and lacking in detail. Someone with HPD will express a very strong opinion with a lot of dramatic flair, stating, "Jimmy, the new secretary, is absolutely the brightest and best we've ever had in this office in the 10 years I've been here." But then when asked why, the person with HPD will give only vague reasons without really any ability to support their opinion. When asked, they might say, "Well, Jim does a lot of good stuff and he's really good." No details supporting the dramatic emotional praise that they've given. Number 6, someone with HPD will show self-dramatization, theatricality, and exaggerated expression of emotion. Someone with HPD will dramatically run up to another person, exclaiming how great it is to see them, kiss them dramatically, exclaiming they're so glad to see them, when in fact they saw this person just hours or even the day before. Someone with HPD may sob uncontrollably at what many would consider a very minor event and then rapidly be happy again. HPD patients are very prone to temper tantrums, and the emotions are quick, change up and down. And from the outside observers, including family and friends, people think that they're just faking it. Number 7, those with HPD are very suggestible. This means they are easily influenced by others or circumstances. They will follow strong authority figures, follow current fads, trends, and they play their hunches very quickly. Someone with HPD can struggle to evaluate a condition and make a logical, well thought out decision for themselves based on available evidence. Instead, they just follow the crowd, and especially follow the popular current crowd that gets them the most attention. Number 8, those with HPD consider relationships to be more intimate than they actually are. Someone like a neighbor that they barely know will be referred to as an old and dear friend. Professionals in a professional setting, such as physicians, someone with HPD will call by their first name without any invitation. They may assign a pet nickname to one of these professional people, even though they might be on their first visit and they barely know him or her. Those with HPD are prone to other cluster B personality disorders and also have a significant association with depression and anxiety. They often come under medical care for these accompanying conditions, and this may require medication. Now, HPD itself can be treated with a variety of treatments, including psychotherapy or talk therapy techniques, and this includes psychoanalytic, interpersonal, cognitive behavior therapy, or dialectical behavior therapy, which is a variation of CBT. This is often used for borderline disorder and may be effective given the overlap. That's histrionic personality disorder. And remember, this video is for education, not diagnosis. Seek a qualified medical professional if you or your loved ones are concerned. Thanks for watching, and if you enjoyed what you heard, try these additional videos on psychosis and schizophrenia, and please don't forget to hit subscribe.